Personalized medicine started 20 years ago as a concept within genomic research. For a very long time it remained in the same way, but then it kind of developed over time so that people realized that it could also be related to therapeutic actions and thereby also to treatments for people. Now, starting not so many years ago, we're actually starting to see that these approaches are now being implemented in healthcare systems for the better of the patients. And we started to see it regionally, but now we also see it nationally. In my opinion, this is one of the largest achievements. So something that really started as a scientific specialty, only for nerdy scientists, is now really coming out to the benefit of patients. A part of that accomplishment is also that personalized medicine is today seen as a key part of our future healthcare system. And this has been realized not only by the professionals, the healthcare professionals, but also by decision makers, by funders, by payers, and by politicians. And that is a hugely important achievement, because that was definitely not so in the early days. And why is this important? This is important because without the support for politicians, decision makers, and funders, we cannot continue the journey. We still need to have funding, we still need to develop our systems in order to further accommodate our healthcare system to contain the benefits that personalized medicine can provide. And this will also be a challenge going forward, because we rely on this continued funding, both for research, but also for developing the necessary frameworks within our healthcare systems, and also to train everybody who is involved within the healthcare system. That will be a challenge going forward. We all know that we are living in a difficult world these days. We have a lot of challenges, unrest, and that also means that funding will also be scarce in many cases. So we really need to do whatever we can in order to get the journey going, because by the end of the day, we will end up with a much more healthy population. And a healthy population is the basis for a good society. A benefit of personalized medicine is that you will be able to provide much better treatment to the individual patient. So whatever the patient needs, whether it's a very advanced genomic treatment or it's a much more plain treatment of a much more plain disease, in the ideal case, the doctor treating the patient will have access to all the data relating to the patient and will have access to all the tools to provide the best possible treatment. So thereby the individual patient will receive a much better treatment. Compared to today, where very often patients are getting a treatment okay, but it can be accompanied by very severe side effects, or it can maybe not be very effective. In the next step, if you can do that in general to people, then you would also have, as I said before, a society and a population which has a much higher level of well-being and is much more healthy. And that will benefit all parts of society if that is the case. I think that is kind of the thing that personalized medicine is able to provide better care for the individual patient is kind of the key accomplishment of personalized medicine. Well, I think what we will see over the next 4 or 5 years is that the development about implementation of PM approaches in healthcare will continue. We will see a further development of treatments, for example, within cancer and rare diseases. We will see the concept spreading out to other larger disease areas. And we will also hopefully see a further build-up of the infrastructures that is needed to support these new PM-based approaches. The challenge here can, over the next years, kind of be necessary funding because it costs money. But it's my personal hope that the politicians will see the benefits on the long term of personalized medicine, and thereby still being willing to provide the necessary funding. I don't expect a full implementation in all regards by 2030, but we will continue the journey and it should be well on the way at that time.